I spend most of my years with startups, and then you're getting super excited about partnering with a giant. Sometimes it's a healthcare giant, sometimes it's an e-commerce giant, because your dream is to scale it with the big guys. Okay, you need to plan this partnership, you need to plan the pilot, you need to validate with your partner that it's not only about exercise, it's not only about digital lipstick to say that this solution is now running and both sides are experiencing this technology. You need from the first moment to make sure that your partner is willing and with the right interest to scale it, and not just to say, hey, I run just this pilot because I want my organization to be digital savvy and something like that. And in order to do it, you need to verify that you're working with the right partner. You need to plan exactly what are the outcomes, how can we measure success.
Udi Goori, welcome to 20-Minute Leaders. Thank you so much for spending this time with me. How are you?
Thanks for having me. Exciting. And I think it's always fun, having like conversation, although only the two of us, knowing that many others will listen later. But yeah, I know you good enough, and I was listening to some of your podcasts, so I know it will be very personal, although we know that so many others will listen later.
I think it's gonna be a lot of fun. I'm excited to dive in to the whole world of digital health with you and everything and your personal journey leading up to it. And right before we started, you mentioned something that I thought was very nice and interesting, which was this idea that separation of digital and health, but put together the context of digital health. Your background is not necessarily coming from healthcare. This is where you are an executive today, and you're working at an incredible company that's doing some great impact. But really, you're digital first. And so, tell me a little bit about your own journey leading up to what you're doing today.
Cool. So I'm Udi, with more than 20 years experience in the tech industry. Happened to be around 7 years ago, switching to another vertical. I did e-commerce, I did telecom, I did different verticals, and all of a sudden, by mistake, I would say, switched to digital health. Right now, I'm leading the Israeli team for Elevance Health. Elevance Health is a huge healthcare giant, taking care for more than 46 million lives, where their health plan were taking care of their health journey. We would like to be their partner, not only their insurance company, but a real healthcare partner, taking care of their end-to-end journey. Especially about myself, but let's cover the digital health thing. I think my vision, or I hope to be one day in a situation that we don't need to say digital health anymore. And why I'm saying it, because think about it, like 20 years ago, we start to say, hey, we're going to e-commerce, okay? And then we said, okay, there is the mobile revolution, let's call it m-commerce, and all these kind of things of bringing the tech into different verticals. Think about 10 years ago, we sell digital banking. No one is saying digital banking anymore. Why? Because for us, it's obvious that digital banking is banking. Okay, there is no banking and digital banking anymore. I think the last vertical to come, and this is like really, difficult stuff. And so many reasons why sometimes healthcare is the last one to get into the digital revolution. I assume in 5 years to come, 10 years to come, there will be no more digital health. It will be just health. And this is exactly what we're doing right now. And this is why I'm so passionate and excited about the digital revolution into healthcare. Unlike others, there is huge friction to transform and to digitize healthcare. And I think there are so many good reasons why, because we don't want to move too fast when it's about our health, our lives, and it's heavily regulated. And I'm happy that it's regulated, because I want it, like entities like FDAs and legal and others, to be very involved and to make sure that we're not moving so fast. So many reasons why it's like moving slowly, but I would say slowly but surely. And I think, the exciting moment that people like me, like others, we used to say we're the tech guys, we're the digital part of digital health, are getting, step by step into this vertical. And I think right now we are already in this kind of transition. I can see so many things that we're doing right now compared to 5 years ago. And I'm sure that it will take some time, another 2 years, another 5 years, another 10 years, but healthcare will be significantly better compared to the current state of healthcare.
So what are some of those things that you're so excited about? So you're things that today we're doing in healthcare that five or 10 years ago, very, very different.
I would surprise you, there are so many people that, coming with this kind of vision, coming and say, hey, 2 years to come, we will totally translate the human interaction into AI and into the next generation of technology. I'm not there. I'm, 100% entrepreneur. I'm all in about digital and technology. I think that we need to do it step by step. And there are so many things that we need to fix around healthcare, which are not the latest and greatest and the top edge things about like AI and LLM. And I'll start with just saying healthcare right now is very fragmented. Okay, it means even in Israel, it used to be and everyone is saying, hey, we're the cutting edge of technology and digital, and we have healthcare databases for more than 20, if not 30 years. It's still fragmented. It's still, you can go to a doctor and then to a hospital, and some of the data and some of the interface and some of the communication between different parties, it's still broken and it's still siloed. Same also in the US, same also in other parts of the world. And to be very honest also about, the digital guys like us, we said, hey, healthcare is fragmented. Let's bring the digital glue. Let's bring the latest technology and let's connect the silos. I think right now we have too many tech solutions, too many startups sometimes, too many, very cutting edge technologies, but we still fragmented. We still lack platforms and connection between different solutions. So we're still fragmented. Let's start with this one. And we're spending so much of our time, not only in inventing a new feature, inventing a new product or inventing a new solution, but spend most of our time about integrating new ideas into one platform because we want to fix it. We want your next journey into healthcare to be not fragmented before the digital age. So surprisingly or not, it's not only about the latest and greatest of AI and technology. I think the magic is about highly integrating different solutions into one platform.
Interesting. So you're essentially what if I'm paraphrasing, you're saying that while there's a lot of novel solutions that are looking at how do we improve, I guess, the endpoints, sort of like in security, like the endpoint security, what you're talking about, that what we're still lacking is on a very infrastructure level, the pipes that connect these different data points and connect these platforms to be able to transmit the data and make sense of the data as a whole and not just the fragmentation of data points. I guess it makes sense because healthcare is a lot about synthesizing a lot of signals to make a rational decision, right?
Exactly, you nailed it. And let's think about like what we're doing here in Israel for Elevance Health. Okay, the best way to describe what we're doing is some kind of supply and demand. Okay, Elevance Health leadership came here about 4 years ago, fell in love with the passion and the opportunities, tech opportunities in Israel, and decided that we should be some kind of boots in the ground and connect between the supply and the demand. There is definitely amazing supply of new ideas, technologies, products in Israel, and we should connect it with the demand, with business owners all over the US, especially with Elevance Health, that looking for the next big thing or other solutions. I do feel right now that our challenge is not only validating and accelerating different solutions, but also thinking about how can we integrate this specific amazing solution into one platform, into one cohesive solution. Okay, and we need to do it both, because it's one thing, to meet an Israeli startup and to understand and to do some kind of tech due diligence and biz due diligence and then build the pilots. Israelis are the masters of pilots and prototypes and these kind of things. The magic happens when you see the full picture and you do understand not only how to win the pilot and to win the tech, but also to highly integrate it into the platform and the end-to-end system for a giant like Elevance Health, but also for other giants like hospitals and other healthcare players. And I found it in the last few years that I think more and more people, especially highly passionate Israelis, do understand that it's not only about the next big thing. It's about how can I implement, validate, have like quantitative results and high integration for my solution into the big motherboard, which is the healthcare industry.
Very cool. And so tell me a little bit about from a business perspective, your experience between, you mentioned that you transitioned from e-com to telecom and now to healthcare. So you've seen different types of, I guess, ecosystems and industries. They have different priorities where business lies versus, the different constraints of the market. And we were speaking about this a little bit before the recording as well. What is your perception of the world in healthcare?
It's interesting, and I think I'll use your example of bringing e-commerce as an example for another vertical that validates its solutions to healthcare. Okay, people are sometimes thinking, okay, this is like great idea, this is great product. All I need is a prototype and to test it and to make sure that the customer is satisfied, and I'm good to go. But also, when we are bringing new, latest and greatest solution in the e-commerce industry, it won't be that another day later, Amazon will implement it and will use it. They will do A/B testing and validate and see some quantitative value based on this product. It's the same with healthcare. We can't just say, hey, but this doctor is excited, or this patient or this member is super happy with this solution. We need to play the same game and to have very quantitative results and value in order to jump from just a pilot and just a prototype into a large scale solution. And unlike e-commerce, although in e-commerce and others, they will do A/B testing, they will do maybe day-to-day testing in order not only to validate, but to get this solution into the very optimized place and solutioning. Same also with healthcare. But healthcare do bring, and we're lucky to have this kind of clinical trial, almost heritage, okay, of checking and validating each and every solution. We need to win both the patient. He should be in love and happy with the solution. We need to win the doctor, the physician, the hospital, but we also need to win quantitative clinical value. Okay, and for this one, you need to design your pilot, you need to design your solution in order that you should have not only just high level KPIs, very measurable outcomes, clinical outcomes, cost of care outcomes, dollar outcomes, in order to make sure that your solution is not only nice, it's not only make people happy, but with very validated results. And I think some people do have some concerns or saying, hey, but healthcare should be about just bring me a good solution and bring me better health. I think we should also validate it and be very measurable with our outcomes. Otherwise, we can scale any solution just because we're happy about it or excited about it.
And so what are the pitfalls with not doing that? What have you observed are I guess signs or symptoms or indicators that one is not thinking in this way? Because it sounds like you're speaking from experience of why this is especially important here.
Absolutely. And, I spend most of my years with startups, and then you're getting super excited about partnering with a giant. Sometimes it's a healthcare giant, sometimes it's an e-commerce giant, because your dream is to scale it with the big guys. Okay. you need to plan this partnership, you need to plan the pilot, you need to validate with your partner that it's not only about exercise, it's not only about, digital lipstick to say that this solution is now running and both sides are experiencing this technology. You need from the first moment to make sure that your partner is willing and with the right interest to scale it, and not just to say, hey, I run just this pilot because I want my organization to be digital savvy and something like that. And in order to do it, you need to verify that you're working with the right partner. You need to plan exactly what are the outcomes. How can we measure success? Is it just about the happiness of the patient, the happiness of the doctor, the happiness of the health plan? Or is it like validated results that we can move the needle and make sure that this solution makes sense economically? And, getting into the economics of healthcare, first, it's fascinating because that's the way we're validating the spend of dollars in healthcare. But when you nail it and you have the right experience and the right experts to have this kind of economics discussion about your solution, you're in the right way. It will take you a few times and few iterations, to fix and to get to the right numbers and to fix your product in order that people won't be just satisfied, but also to show some economic results. But when you're there or almost there, this is like the magic moment of each and every product. This is where we're heading, both from the startup side, but also from the last few years that I'm spending with Elevance Health.
I love it. What really gets you excited today in your line of work? So what is it about what you do that really, it sets you up on fire?
Ooh, I think it's about me. I am both very techy, going back, tens of years. I was always excited about, technology and products. I'm some kind of a builder. On the other hand, I am more excited about, integrating not only product and solutions and technologies, but also people and organization and different entities into one solution. So for me, the magic moment is, falling in love with specific technology, but not only because of the technology, because of the potential. And when you can connect, going back to supply and demand, you can connect with highly passionate, Israeli startup coming with interesting technology, and knowing that this one can move the needle with a business partner there in the US, and then walking the talk, because you can do it in a matter of weeks, sometimes not months. It takes between 1 to 3 years to validate, to walk the talk, to fix so many things. But the magic moment that you understand that this is not just a pilot, this is something that you can scale, this is something that can go to the hands of millions of lives. I think that this is the magic moment, especially with healthcare, especially when it's about others' lives, and in the case of Elevance Health, but also with other US healthcare giants, like it's a matter of millions of lives that you can impact.
And so for aspiring entrepreneurs that are now perhaps finishing their army service or university around the world, how should they be thinking about digital health or health, because we perhaps won't have to call it digital health in the future. How should they be thinking?
Yeah, we can still call it digital health, but yeah, one day let's connect when we can remove the digital. But yeah, totally. I think, my advice will be think like a generalist. Okay, healthcare is complicated. Digital health is a multidisciplinary thinking. You need to be some kind of end-to-end thinker, to combine together or to compile so many clinical insights, tech insights, business insights. I think it's like, yeah, you can say it in each and every vertical, but especially with healthcare, especially with digital health, you should have your skill set ready to have different conversation with so many experts in so many fields. And the keys to success is not only to fall in love with the tech side. This is like the easiest part because we're Israelis. We're always in love with our solution, with the latest and greatest. In some cases, with deep technology that we can bring, but also to combine it with business thinking, with listening to others, to other experts, and to understand the art of possible. And like Israelis, we always like dream about the next big thing and how can we move fast forward. We need sometimes to balance it with other expertise like clinical expertise and business expertise. Only when you can balance it and work with others and partner with others, okay, and especially with healthcare, especially with digital health, you can be successful as a startup if you're not partnering with a giant like Elevance Health or with other giants. I think not like only very few startups are really doing good with partnerships, and we should be much better with our partnerships skill set.
Udi, I really want to thank you for spending this time with me. It was lovely and so interesting to hear your perspective and clear passion for what you're doing. And I think the fact that you've had this progression over these different industries just speaks volumes to why you're here and why you're doing what you're doing, which I think is really awesome. So I really
Cool.
appreciate your time here.
It felt like 5 minutes, and you said
For me
20.
for me it was 3. It was a lot of fun.
Anyway, just tag it part 1, okay, and we'll do part 2.
Exactly. Thank you so much, Udi.
Thanks, Michael. Pleasure.
Thank you.
Really pleasure.